Welcome back to HIP, Health Insurance Personalized. If you are a health insurance consumer, efficient free market always responds to consumer demands for products, services, and information. They always do. It is time to try a system that focuses on the consumer and the patient's needs, folks. Consumer and patient's needs. So it has to be consumer-driven, patient-centric. So today's topic is healthcare consumerism. This is Consumer's Doctor on the behalf of Foremost Organization. As a consumer doctor, I believe this is the only way we can cut down the costs of the healthcare. This is the only consumers have the demand. Consumers' demand will drive the cost lower because of competition and price transparency, folks. Let's explore that. Let's explore the healthcare consumerism. Someone will tell you, oh, we have already tried free market approach in the years before Obamacare. We already have tried it. But pre-Obamacare was not a free market. They forget to. It was not a free market, folks. We have never tried a free market. You and I know that was a bad system, folks. It was a bad system. Before Obamacare, healthcare lobbyists had their way. They had their way. That structure included laws and regulations. Number one, consumers were powerless. They were powerless when seeking to purchase a coverage. And number two, insurance restricted providers and services patients could access. They restricted that. And number three, cost and quality information was hidden from us, folks. It is hidden. And number four, individual consumers had no power to negotiate premiums or understand why they were rejected to coverage in the first place. They had no power. Consumers had no power. And number five, a few powerful insurers limited coverages, provider alternatives, plan choices, innovation, and pricing competition. Very few insurers had those different aspects like insurance coverages. Very few insurance had provider alternatives. They had any plan choices or any innovation or competition in prices. Very few of them. What you may not know, that the laws and regulations were mostly written by the insurance industry lawyers, folks. Insurance industry lawyers. That's what it is. For those insiders, limited competition and market share drives the process. Yes, for those insurers had limited competition and market share, they drive the prices. Consumers are ignored. We don't want to revert to that system, folks. We don't want to revert to that system. Believe me. We can't let insurance industry lobbyists write the laws of post-Obamacare. We will get shafted for the second time. Yes, we will get shafted for the second time. If you are a consumer, efficient free market always respond to consumer demands. Always respond to consumer demands for products, services, and information, folks, and information. But we never had free market for health insurance. We never did. It is time we tried a system that focuses on the consumer, our customer, and the patient. So consumer-driven, patient-centric, folks. It is time we tried consumer-driven, patient-centric system. So politicians and insurers aren't working to help you or me. They're not. They're not helping you or me. Politicians have been promising repeal and replace plans for over 10 years. For over 10 years. Yet nothing gets done. Nothing gets done. They have been either unable or unwilling to develop an alternative to Obamacare. Yes, moreover, in 2002, insurers had their lobbyists have been fighting against. They've been fighting. This is a weird. In 2002, insurers and lobbyists have been fighting hard against expanding account-based plans, so-called health savings accounts. They've been fighting. Why? Because HSAs, health savings accounts, put control into the hands of the consumer. That's the beauty. It puts into the hands of the consumer. Only HSAs or personal care accounts does that. Insurance companies have been fighting against it. So recognize this truth. Lobbies and existing vested interests will preserve the status quo and work against your interests in choices, treatment options, and affordable insurance. They work against your interests. It is time we demand change that acknowledges your unique needs of personalized health insurance, otherwise known as consumer-driven health insurance. The new health insurance system is consumer-driven and patient-centric, folks. Personalized health insurance is an approach to get insurance you want, when you want it, at an affordable price. That's the beauty, at an affordable price. You and I want coverage improvements. Yes, affordability, and more treatment options, and healthcare options too, It is time we take control as consumer. We take control. We can't let government or insurance bureaucracies come between patient-provider relationship, folks. We can't let the government come in between patient and provider relationship. That's true. We cannot let them set rules that tell doctors what they can or they can't do. We cannot let them do that. They cannot be allowed to say who we can see for our health care or what treatments we are prescribed. They cannot. Upcoming, basically, personalized health insurance will improve the delivery of care, lower premiums, improve quality of treatments, and adds new choices, folks, adds new choices. Personalized health insurance includes the most popular Obamacare consumer-oriented features. They embrace all of it. Let's look into them. What are they? They embrace all the features of Obamacare. Number one, guaranteed issue of insurance. Very important. Guaranteed issue of insurance. And number two, coverage of pre-existing conditions. That was a big thing in Obamacare. Coverage of the pre-existing care. And number three, dependent children. Coverage at the age of 26. Till the age of 26, folks. Dependent children till the age of 26. And number four, unlimited lifetime maximum. That is why we need an insurance. Unlimited lifetime maximum, folks. And number five, comprehensive major medical insurance coverage, which were not there before, prior to the Obamacare. But after the Obamacare, so the personalized health insurance will embrace all these five features. I want you to reiterate that. Number one, guaranteed insurance. Number two, coverage of the pre-existing conditions. Number three, dependent children covered till the age of 26. And unlimited lifetime maximum, number four. And number five, last but not the least, comprehensive major medical insurance coverage, folks. Comprehensive major insurance coverage. Personalized health insurance builds on the strengths of this country, folks. It includes efficiencies, innovation, choices, and consumer focus of a free market with consumer protections, patient empowerment, and limited government oversight, folks. Limited government oversight. It does not include least popular features such as price distortions by age, excessive coverage mandates, limited policy choices, and single risk pooling. It does not include that. It does not include single risk pooling, folks. If we can't unite around a version of consumer-oriented, personalized health insurance, then surely we will all head towards one-size-fits-all government structure that fails to meet unique insurance needs, folks. It fails to meet the unique insurance needs. A consumer-driven, patient-centric approach is ideal, and this is the only way we can lower the costs of the healthcare, folks, because consumers demands it. Consumers have the power to lower the cost, and you give them the incentives and rewards to the consumer, they will drive the cost of the healthcare down. No matter what anybody says, only consumers have the power to lower the cost of the healthcare. We have spent $3.7 trillion, folks. $3.7 trillion in 2018. America still ranks 37th. 37th, how about that? It is simply not acceptable. Simply not acceptable. Give the power back to the consumer, folks. Give that control back to the consumer. They will drive down the cost and give them the tools what they need of having health savings accounts, personal care accounts, and including Medicare. Medicare should be investing on the seniors, not into the private insurance companies. Give those tools to the seniors. They will spend it wisely instead of giving whatever monthly contributions to the private insurers. Give the same power to the seniors. They will drive the cost down because you're setting up personal health care accounts, so-called health savings accounts. Whatever the money saved from the insurance, it goes into the health insurance accounts, folks. Even the Medicare Advantage is not a Medicare Advantage, folks. It is a Medicaid disadvantage. You know why? These managed care organizations is taking away your control of your health care. I would like to see seniors, AARP members, if you guys are listening, take back that control. Have them invest in you. Give whatever they put into these insurance companies. Give that money to the seniors. Seniors will be able to choose the insurance what they need, and money saved should go into the personal care health savings account, folks. That gives the consumers the power and drive down the costs of the healthcare. That's the only solution, folks. That's one of the reasons why America, if it wants to be number one in healthcare, consumers have that. Look at the other industries. Look at the other sectors. Consumers have the power. They have the power to drive down the costs of the healthcare. Thank you, guys. Thank you for listening. This is Consumers Doctor on the behalf of Foremost Organization. We will see you in the next episode. Goodbye. Salute.